Good morning. Today we'll be talking about breast cancer because even though it's the end of the breast cancer month, it's still very important and very relevant. Thank you, Dr. Dawodu and Abigail, for coming on the program. Abigail, it's always a pleasure to have you in, year out. I think the important thing is for people to know that you are surviving and surviving with grace. So thank you very much for coming on the program.
Thank you very much for having me.
Dr. Dawodu, can we ask you, for those who are listening who have not heard, which I don't think is really possible, what is breast cancer and why do we need to know about it?
Thank you very much, Dr. Pamela, for having me on the show. It's a pleasure. So to dive into it, breast cancer is a cancer, it's an abnormal growth in the breast that develops from cells proliferating or growing without the normal regulation that would arrest it. And it occurs in different parts of the body. This is cancer. So in the breast, this is what happens. These are abnormal cells that grow without regulation, basically.
And who's prone to it? And why should we know about it?
Yes,
who's prone to it?
Well, anyone who's female and even a few males, about 1% have been known to develop breast cancer. But anyone who's got breasts, basically, and, is prone to breast cancer, albeit there are different modalities as to when, the development of breast cancer can occur. And since we all have breasts, it's very important for us to be aware of the risk factors and the things that are associated with development of breast cancer. And so we talk about modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors: getting older, growing older, family history of breast cancer, modifiable, things like early menarche, late menopause. So being exposed to estrogen for a prolonged period of time has been known to contribute to breast cancer. And then the modifiable ones are things like obesity, smoking, consumption of alcohol, and then exposure to certain drugs that have estrogen, that proliferate estrogen in them. So those are some of the things that we need to know about it. And then I think I mentioned earlier, a strong family history. For those that have family history and then genetic mutations like the BRCA mutations. So you see this usually in women developing this breast cancer younger, and you see it coming up in people that have first-degree relatives, even though it's kind of the same in terms of prevalence in those that have a family history. But with BRCA, they come down with this breast cancer at a younger age. It's associated with ovarian cancer. And so it's very important to be aware of this information so that one can do the necessary tests to be able to make a diagnosis, basically.
No, absolutely. And I know as a histopathologist, you're particularly interested in biopsies and the results that biopsies show and what having a proper biopsy and having it properly examined can do for a woman. So can you share with us, because sometimes women, there's a lump. Oh, does she need to have it taken out? Does she need to have a piece? Which one is the fine needle? Which one is not the fine needle? It can be very confusing. What should they do? And why is it so important? Why is it the doctors always want to have a piece of it? Please, let us know.
Thank you very much again, Dr. Pamela. So it's very important when a woman gets a lump discovered to have it properly examined and the correct investigations done. And as a histopathologist, as you mentioned, we work around the cells and the tissue that help our other colleagues, the oncologists, the surgeons, and everybody else to make the right management. So basically, the advice is for women that are less than 40 years of age, we usually ask that they have a monthly examination of their breast, probably around after their period, to examine their breast. And if a lump is discovered at that point, an ultrasound scan is encouraged in younger women to kind of get the modalities around the breast lump. And for women that are older than 40 years, it's recommended that a mammogram is done. So if a mammogram is either discovered by physical examination or ultrasound or through the mammogram, the next steps that we advise are for the woman to get the lump checked out by a pathologist, basically. And there are different ways that this can be done. So you can have the lump checked through what we call a fine needle aspiration biopsy. And what happens is that we use a specialized needle to take some cells from that breast lump. We prepare it on a slide and we're able to look at it under the microscope to say whether we can see cancer cells or there are no cancer cells there. And another form of examination that we carry out is after the surgeon has taken out this breast lump. Sometimes, depending on the size and certain modalities, and like I mentioned earlier, what you see under the fine needle aspiration biopsy or cytology, you're able to give guidance to say, okay, let's watch and wait. If the person is maybe 18 younger, it's benign, and you just want to watch before there's any further intervention. But definitely, if you have worrisome features like there are inflammatory cells or there are these cells that just don't look normal, then we encourage that the lump is taken out. And what we do with that is we take it out, we prepare it, and we look at it under the microscope, and we're able to say that there are cancer cells there or not. But it doesn't stop there in terms of pathology. Now, in going further to be able to help in the management of this patient, there are now what you call receptors that we talk about that help in the management of patients. Because breast cancer in itself is not one disease. It's a heterogeneous disease, even when we put it under breast cancer, that the breast cancer in Mrs. A, Mrs. B, and Mrs. C are all different, and they will not benefit from a one-size-fits-all treatment for breast cancer. So depending on what the outcome of the receptors are, we talk about ER, PR, HER2, we're able to say who is going to benefit from hormone therapy, ER, PR, if it's a triple negative breast cancer, which means that it's not expressing any of the common receptors we talk about, then we begin to talk about chemotherapy, radiotherapy, and then if it is what we say HER2 positive, there are certain drugs that have been developed through research to be able to help patients with that kind of breast cancer. And so for a pathologist, those are the areas we're very happy to be able to work with the multidisciplinary team for breast cancer.
I think what for me is really exciting is the fact that there's been so much progress made in the treatment of breast cancer. Now we're talking personalized medicine. We can take it, we can look at the lump and say, this will benefit from X, Y, and Z. And we hit it with that, and it goes, and it, and it works. And I think that is where, breast cancer is now, and in some places it's called curable. And that is something that a lot of women need to take hope from, because a lot of women still in our environment are coming in too late.
Yes.
They're coming in far too late. And I don't know what words you have to talk to them, how you want to encourage people out there who could be even sitting here quivering, shaking, listening to today's program and thinking, this thing has happened, it's not my portion, it's not my portion. And, talk to them so that they know what they need to do.
So what I'd like to speak to them about is early detection makes it, just like you mentioned, makes it more manageable, and we would say even curable. People are able to live long, productive lives. We have beautiful Mrs. Abigail on the call as well. Yes, so early detection is very important. You discover something that is abnormal, please go and get it checked out. And of course, for those of us that are physicians and even anyone who's interested in the fight against cancer, we have a lot of work to do in terms of advocacy that transcends the demographics, basically. So giving information and things that patients or women need to look out for so that they seek help on time, and it's not coming in too late before they can benefit from some of these therapies that I spoke about that are evidence-based. That's what I would say to them. It's not a death sentence anymore. Like how people are living with diabetes and hypertension, we're able to work with the therapies that we have now to ensure that we guarantee some quality of good life after the diagnosis of breast cancer.
No, thank you so much. And I don't know if I can bring Abigail in at this early stage. Normally I talk to her in the second half, but I think I'd just like you to perhaps speak, Abigail, to this personally and talk a bit about your own experience when how long ago it was that you had the diagnosis, but and just chatting briefly about that before we go off on our break.
Okay, I think awareness is very, very important. I had a mother who had breast cancer and survived it, so I was very breast aware. So I think the first thing is awareness. Then secondly, I felt something was wrong. I'd had a mammogram done, but I still felt something wasn't right. So I went for a second opinion. And I'd like to mention that gut feel is really important. If you know your body well enough, you will know when something is wrong. So if you feel something is wrong, you see a particular doctor who says, oh, there's nothing. There's nothing wrong in getting a second opinion. If necessary, go for a third opinion. We've had where it's on opinion 3 that they finally got listened to. So I think that's the first thing, is trust your gut. Secondly is self-breast examination. It is absolutely fundamental to know when something is wrong, because I'm really fortunate that the cancer was caught early and I'm cancer-free 10 years down the road. So it's all about early detection. And even if it's not, I think I would also like to mention that because there's so much advancement in treatment, even people with a stage 4 diagnosis are living much longer, more productive lives. I know somebody who was given 6 months, she's on year 8, and she's thriving. So I think that it's really important to know that there are solutions out there. Cancer is very different from my days 10 years ago when I was diagnosed.
Thank you. Thank you very much. Well, thanks, Abigail, for sharing that. I think it's so important that people know, and not just know. This is why, for me, it's such a joy to have you come back year in, year out to show that, look, this is real. We're not saying things are not real, and people can really relate to you. Thank you so much for sharing and for caring, really, and sharing your life experience with others, because I believe you're a huge inspiration to so many people. Now, talking about Breast Cancer Month, this is Breast Cancer Month. I've not noticed the amount of activity that we normally have for breast cancer. Do you know why?
I think it's a combination of things. I think the economy has played a very big role. And that's COVID, first of all, wiped out quite a few NGOs funding. And then with the economy in the country now, it's really, really difficult. So a lot of people are doing more online awareness, and then you have the online to see it. Because fancy big parties, really. Personally, I don't like Pink Month. As a breast cancer survivor, we're pinked out. By the time the month is over, I'm exhausted from speaking on different shows, etc., etc. And then the rest of the day, nobody calls you. So it's exhausting for the donors, it's exhausting for the patients, it's exhausting for everybody. And breast cancer does not choose October to strike. It is any day of the year. So I really think that it's really about creating awareness all year round, and the culture of screening and the culture of self-breast examination. That is really what we need to do. So I think that is a combination of economy and a combination of the fact that I think there's so much information out there that people tend to ignore it a bit more. It's no longer a novelty Pink Month. At the beginning it was a big deal, Pink Month, Pink Month. Now someone's like, oh God, it's Pink Month again. And I've heard people say that, oh God, these people are going to start disturbing me again for donations. You know what I'm saying? So I think it's about balancing it out is what we need to do now. And make it real, that is every day. Cancer is every day, whether it's breast cancer, childhood cancer, whatever cancer, it is every single day. Check yourself,
You are having a very special event coming up at the end of this next month, aren't you?
Yes.
Showing that, look, November is Breast Cancer Awareness Month as well.
Yeah.
Can you tell us what's happening and how people can engage and get involved in what you're doing?
Okay, we're super excited because thanks to the generosity of Echo Hotel and Suites and Centerpoint Hospital, we're actually having the first ever Cancer Champion Conference for cancer champions and advocates. It's never happened before. We're super excited.
What's a cancer champion?
We like to call them,
so that people
so
know.
it's people who have survived cancer or are living with cancer. We believe that everybody's a champion. From the time you're diagnosed, the battle begins. So we don't like using the word survivor. It makes you look like you're, oh, poor you. So we now adopt the term champion for anybody who is fighting the disease or has conquered the disease. So it's called, we're talking about harnessing the power of lived experience to transform cancer care in Nigeria, because we believe that every cancer survivor is an expert. Nobody knows the disease better than you that has walked in those shoes. So we're using this opportunity to talk to government, talk to healthcare, talk to NGOs, talk to the medical and healthcare sector, say, okay, look, listen to what we have to say. We need to work with you to create policies and guidelines that are realistic and are pertinent to what we face as people who have gone the journey. And and we don't want it to be a buzzword. It's currently trending in the world now, co-creating priorities, co-creating this and involving people with lived experience. We want it to be real. You know, we want it that Nigeria will lead for Africa, to say, okay, look, we are having our Cancer Survivor Conference. We are engaging with all the stakeholders. We cannot do this alone. And if we all join together, we can come up with policies that are relevant and that will really transform survivorship, not just in Nigeria, but Africa as a whole, because the whole of Africa has similar challenges in terms of access, in terms of awareness, in terms of religion, beliefs that are impeding things. So we think it's so important to really highlight that. So we're really excited about it.
No, that's fantastic. Can you tell us when it is? Just in case, sort of that is something that we'll announce on this program just before then.
So it's strictly by invitation because we have lit spaces, but it's on the 24th of October, 24th of November in Echo Hotel.
Okay.
Where for the first time, there's several cancer NGOs that are going to collaborate because we really believe it's about collaborating. So we're collaborating with Commode, Cancer Nest of Hope, Somkolia, Nepisin. So there's quite a few of us that are working together because it's all about working together. The tendency is that a lot of NGOs tend to compete. And we're now saying, look, the only way we can beat this cancer is to form one voice and speak with a singular voice to say, look, we are able to do this as a team. So it's really about teamwork and collaboration now.
That's fantastic. Now, you spoke about religion, and that's a big one. I know Dr. Dawodu has some thoughts on that as well. I mean, how do we overcome this thing that, you know, people want to pray it away instead of adding, you know, religion to the treatment and making it work? I don't know. How do we do that? And why is it that our pastors and our various other religious people take people away from hospitals and not actually take them to it?
I think it's a combination. I think not all churches are the same and not all religions are the same. There's quite a few churches now that are actively screening. And I think to a certain extent, it's also about ownership of your own health and your own faith. You know what I'm saying? I know people who have been told by their pastors, don't go for the surgery. And they've told the pastor, look, pastor, I just came for you to pray for successful surgery. So it's about working out your own salvation, you know? And I think it's also really important that people who work in the cancer space know the Bible and know the Quran. Even Jesus had a doctor in his entourage. So if Jesus can have a disciple who's a doctor, there must be some reason for having a doctor around. Also, I believe that it's important to know that there's nothing wrong. God heals and he can choose how he heals. And I always say that when you're asking God to heal you, don't tell him how to do his job. I was healed by medicine in a hospital. Once you have access to care, that in itself is a miracle. Once you are able to go through treatment, that in itself is a miracle. So I think it's really about NGOs and hospitals starting to work with hospitals and also encouraging people to also read. The Bible says, my people perish for lack of knowledge. It's ignorance. There's nothing wrong with combining. I couldn't have survived cancer if not for my faith, if not for my belief that there was a purpose for everything. So I really think it's about working with churches and religious leaders to incorporate faith into the treatment plan. It's about holistic care. Cancer care has to be, you have to look at spiritual, emotional, physical, financial. So it has to be a holistic approach. And that's what we really need to do in this country, is start working with religious leaders and traditional healers as well. No? Because there's some element of good in traditional medicine. We just need to find a way to research it and also measure it. Because the problem with a lot of these traditional medications, it is word by mouth. It's not written anywhere. So one leaf off can turn something that is good to poison. So I think we really need to start looking at research because we can't continue to be using white people's medicine for black people's cancer. We already know that black cancer does not respond the same way as white cancers. It's more aggressive, it's in younger people. So we need to start looking inwards. What do we have within our country, within our resources to solve our problems? I think it's important.
Yemi, do you have anything to add to this?
Yes, I did. Thank you very much, Abigail, for that. I think, you've put it very importantly. It's a disease that requires a multidisciplinary approach to it, of which religion is one of the aspects that we have to make allowance for. So like you correctly said, we need to, even as doctors and physicians, ensure that we incorporate religion into what we're doing, and also work as well to, inform. We work with evidence, just like you were talking about in terms of research. Most of our stuff is, yes, evidence-based. So in speaking to, talking to religious leaders, whether they be in the mosque, in the church, or even traditional, we need to incorporate them as well and also increase their own knowledge and awareness in helping to bring some succor and also promote, the areas and the channels to get treatment for patients that have cancer. And that's what
I don't know if I can. Yes, I don't know if I can
lot
share.
of room for persuasion in
Yes.
incorporating the religious bit of looking after cancer patients.
Certainly, certainly. And I think that also to let you know that the first, I think, university also for traditional medicine is going to be
Yes,
set up, I
that's
believe, in Ekwe.
in Lagos
So
State. Yes,
yes, in
That's
Lagos
fantastic.
State is
Lagos State.
actually
Yeah.
looking into that alternative healing because I mean every part of the world has it. I mean in India there's Ayurveda, the Chinese have their
It's
medicine.
regulated
So
properly.
we need, yes,
Like
it's very
Abigail said,
regulated,
yes.
it's properly researched, and it's important that we look into how we research our own medicine as well. Unfortunately, this has been such an interesting discussion. So, but time has come to the end. So, Abigail, do you have any last words for our listeners before I go to Dr. Dawodu?
I would just like to say, if you notice anything different in your body, whether it's your breast or the rest of your body, go and get it checked. It's really important because early detection saves lives. I'm alive because the cancer was found early. It's as simple as that. So go and get yourself screened. Also, check your breast every month. Choose a time of the day, preferably 5 to 7 days after your menses, if you're still menstruating. If not, just choose a day. And please, if you notice anything different, get your breast checked, please.
And I would like to lend my voice to Abigail to say early detection saves lives. And like she correctly said, ab initio, even late presentation is no longer a death sentence because there are therapists here to help with that. So please familiarize yourself with your bodies, with your breasts. And, if there's anything untoward, please get it checked out on time.
Men
Thank
as
you
well.
very
I
much.
think,
Men as well, please. Men as well, because men do get
yes,
breast cancer.
thank you. And for me,
Yeah.
what I'd like to say is when you do find something, don't wait. I think for me, that's the key. Sometimes they wait in fear, they wait in they hope against hope.
Be paralyzed.
Don't wait. Go straight in and have it looked at and have it treated. I just want to encourage people on that. Thank you so much, both of you, for
Thank you very
coming on the
much.
program. It's been a real pleasure.
Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.